Caring for the Elderly, and I invite our speaker for this session, Dr. Peter Castellino. He is the Managing Trustee of COOJ Mental Health Foundation. May we all invite the speaker with a round of applause.
Good afternoon, everyone. And right at the beginning, I'd like to thank Roland Martins and COOJ for inviting me for this. Can you hear me? Yes. Okay. I would like to thank Roland Martins, COOJ, and for inviting me for this talk. And one thing which was coming up very clearly is, first of all, number one, I really appreciate the crowd that is here. I mean, a similar talk was given in South Goa, and they were like, where 2 or 3 are gathered in his name, just that many numbers were there, But today, I'm really kind of, I appreciate the overwhelming response and the number of people that really want to come here and understand the needs of the elderly and what can be done. And the lady who asked that last question, I mean, I really appreciate her question, which is so valid. We talk about maintenance in terms of finance, but what about the emotional support? And that's what we really need to look at today when we're caring for the elderly. It's very complex. And I see a lot of the schemes possibly are created from a top-down approach, where people sitting on the tables, they think they know what is best for the elderly. And first of all, the act is wonderful, there's a lot to it. But I think when we're looking at schemes, we need to sit with the elderly. We need to take a survey of their needs and understand their needs from their perspective. And when you look at it from their perspective, you really understand that yes, financial needs are important, but also emotional support. And if we do not give them that emotional support, money sometimes doesn't matter. A lot of people have money, but how do we effectively care for someone who has no one to care for them? Okay, I got to do this myself. Yeah, so we're going to just look at the demographics of the elderly in India. And if you look at, there's already about 100 million people above the age of 60 in India. And the lifespan today is increasing from 32 years of age in 1947 to 64 in 2008. So you see almost a double number of people, aging. Then if you look at the infant mortality rate, it is now reducing from 80 to 52. So more people are alive, more people are being born rather. And if you see, the crude death rate again has reduced by half. So again, we are seeing by 2050, there's going to be almost 324 million senior citizens in India. So we're looking at an explosion that's going to take place. Now, how old are older adults? What do you think is the age for older adults? There's a young old, between 65 to 74. Yeah. So anyone who's like just about 60, 65, you're a youngster in the senior citizen category. You just entered, you're just being born over there. You're just understanding. Then you have the middle old, which is 75 to 84. So again, you just you come off the middle age. Yeah, you're the middle age and the senior citizen category. And then you have the older old, 85 to 99. Do you think this thing will go higher than this? Yeah, it can go higher. Yeah, up to what? Father-in-law was 95, would still be under older old. You have the extreme old, which is 100 plus. So when we're looking at caring for the elderly, we're actually looking at it at each level. The needs would be different. The needs would be different again, not at each level of age, but also at each level of ability. Because the abilities may be different. You might have a 100-year-old who's cognitively much better than a 65-year-old. Whose memory is fantastic, and you'll have some people in their 40s and 50s who can't remember anything. but you'll have someone who's 95 and growing really strong. So when we're looking at caring, when we're looking at schemes, when we're looking at what can be done for them, we have to assess level of ability. Now, mental health in older adults, please remember that just because you're growing old doesn't mean now you're going to have all mental health problems. Mental health is just very much normal in a senior citizen like it would be in a younger person. So just if someone is forgetting more, it doesn't mean that now he is growing old. And because he's growing old, he's having a mental health problem. He possibly is having dementia. So forgetfulness not necessarily means just because he's growing old. Younger people, as I said, could also have the same problem. So most older people do not develop mental health problems, and they can be helped if they do so. Now, this is something very interesting, and I think we all understand what's happening around the world. The breakdown of the family system. And that is the key thing where now the needs of the elderly have changed. Because more and more people are migrating for better prospects, leaving their elderly parents back at home to fend for themselves. And I think everyone can identify with this. Everyone knows that this is what's happening. I just want to give you an example over here. Again, when we look at how this is affecting our people. I know of a family, okay, who husband, wife, and 3 children. Okay, now 2 children have migrated outside. There's only 1 child living with the parents, and then the father died. Though the 2 children migrated outside for better economic purposes, gains, they are yet not financially stable. So this girl who lives with the mother, she works in someone's house. Okay, she goes to someone else's house to work. There she gets a salary of around 1,000 rupees a month. She works from 8 in the morning to 6 to 7 in the evening as a helper, okay, in the person's house. Now this elderly lady is at home. Now for most part of the day, this elderly lady is fine, and most part of maybe time. But there are very, very strong periods when this person, this elderly person, gets suffers from some kind of problems. The problems would be where she has these delusions, where she begins to believe that people are against her. She starts hallucinating. And when she starts hallucinating and has these delusions, she begins to create problems in the neighborhood. Now, what happens is, here in this particular case, the child is actually trying her best to look after the mother. So it's not that there is a neglect. She is trying her best, but she has to balance both her work as well as caring for the mother. Now, if she is not at home to look after the mother starts going and abusing all the neighbors. So she has to be at home. Now, if she is at home, she doesn't get her salary. The number of days where she'll be working productive will reduce. She is in a quandary. So here again there is a case, and there are many, many such cases. Now we can say, suppose we have to transfer her to a hospital, okay? Take her to, we say, okay, the government has a system, take her to the hospital. What happens when she goes to the hospital? The hospital say, fine, we'll admit her, but someone has to stay with her. So now she's staying over there. If she has to hire a caregiver, how much are caregivers, how much do they charge today?
1,000 a day.
1,000 rupees a day. Her salary is 1,000 rupees a month. Okay? Now the matter is sorted out. But what I'm saying, these are the issues. Here again, I'm telling you, I'm re-emphasizing there is no neglect. But who is having the burden? The caregiver. And because the caregiver is not able to effectively look after the mother, the senior citizen or the mother is having a problem. So what is the result of this migration? Nuclear families are emerging at a fast pace where older adults are being left in ancestral homes, and a lot of these homes are huge, having little or no personal, personnel, emotional, economic, social support and care. And this is the reality. I think we all know, in the village I come from COOJ, and I look at my own Vado. The place used to be bustling with life. At our chapel feast, there'll be lots of people coming. Today, it's one person living in huge ancestral homes. Just one person. And when I look at them, their life it's really sad. It's really sad. There's one person who has, mentally she's very good. Physically, she's not able to go for, maybe if you have like a meeting of senior citizens, she's not able to come because her legs do not allow her to walk that distance. In fact, it's worse for her because her mind is so active. So she feels isolated. In fact, the isolation is growing more and more as migration is happening. And this is again reality. Resulting in loneliness. Loneliness is the biggest killer among seniors. I run an organization called COOJ Mental Health Foundation, and as part of our activities, we run an elder care program where we go to senior citizen homes. And I mean, first we kind of did a little survey and we saw a lot of people live in senior citizen homes. Fantastic. I mean, at least they are being looked after, they're cared for. But the plight of the senior citizen homes is what? The staffing is very small. Okay? It's very limited. And because it is limited, they're able to look after their basic needs of the seniors. Their physical health needs is looked after, their food, their shelter, their clothing. Their basic needs are able to be met. But what about the quality of life? Randomly, they will have some group coming in and having an activity with them. Randomly, maybe during festivals, a whole group will come. But what about throughout the year? And again, when you randomly get into a home, you're not really connected with the seniors. You feel you're doing something great for them. You sing a song, you have some games, you have a bingo, and you go out. Who have you benefited? Yourself. You actually benefit for yourself by feeling that you have done something good for them. Have you actually helped them? Maybe temporarily, momentarily, but it makes them feel actually more lonely, more isolated than what they were before. So what is required are sustained programs in homes. And I was looking at the Act. The Act clearly says in an old age home, physical amenities are required. How do we define physical amenities and what is the scope of a physical amenity? I mean, wheelchairs, walkers, and ramps, enough? If you actually look, and there are many, sisters and all over here who are working with the senior citizens. I think we need to talk to them when we create schemes and define the word physical amenity. We need to define it. When I looked at recreational, I think Shruti mentioned, right? And in the Act itself, recreational activities, fantastic. What are the recreational activities that are there? A pack of cards, a carom board, okay, and some games. That's it. And then the Act is implemented. That is not enough. What is required is the emotional support which that person mentioned, which is so very important. And that is not going to happen until the committees are formed, which will actually ensure that there is a regular contact with senior citizens. Please, I'm using the word regular contact. Just a sporadic contact is not going to help. Because what is important, the first step with emotional connection is to connect. To connect. And unless you connect with someone, he is not going to feel loved. He's not going to feel less lonely. In fact, he might feel more lonely. You're not coming alive, enjoying yourself, you're going, oh, what happens to you? Look at my life. But that is what is happening. So we have this program where we go, we have like an 8-month project where we go to a senior citizen home and we build capacity in that home with the community. So we have the COOJ coordinator, we have a community coordinator, we have the coordinator from the home, and we try to get a coordinator from the inmates. So 4 together will create a system where there is constant activities, twice a week, thrice a week, depending on the capacity of the seniors, depending on the needs of the seniors living in that home. It is very, very individualistic. Please remember, we can't just have one model fits everyone. We can have a broad model that fits everyone, but when it comes to the nitty-gritty, it has to decide upon the needs of the home. If there are, in that home, if there are 15 bedridden patients and 2 abled patients, having your recreational activities outside is not going to matter. You have to build activities suited to the needs of the elderly at that time. So our problems and our challenges over here is getting community coordinators, getting volunteers who would be consistent. So this is where we need the government to intervene and actually maybe appoint someone who could be that coordinator, not for one home, but even for 5-6 homes, we can have a coordinator. And this is what we have been requesting the government, but there is no scheme for this kind of work. There are schemes for setting up daycare centers, but there are no schemes for improving the quality of life of people living in daycare centers, in old age homes. Sorry. Yeah. So that is that. Okay. So we know that. Now, what else contributes to loneliness in senior citizens? Death of a spouse. It is on a grade of 1 to 100. It is 100. And especially if the seniors have been married for many, many years, they actually feel now they are alone. Boredom, disuse of skills. Again, I say, I get a lot of calls, I'm a psychiatrist by profession, okay? So I get a lot of calls to old age homes talking about people having memory problems and dementia, But a lot of it we see, and cognitive problems. They can't concentrate, they can't focus, they're feeling very down, they're feeling depressed. But the more again we analyze it and we realize, my God, they're not really depressed. They're just bored. Come on. I think we ourselves, we just put ourselves into one room and just remain there. What will happen to us? We will get bored, sick. But we at least have the opportunity to get out. They can't get out. They're there. And then all their lives, they were in charge. And now no more they are in charge. Now they have to listen to somebody else. Makes it even worse now. So I think programs need to be integrative. I think it's very important to take into consideration their needs, their views in setting up programs. Because that's where we really get what is required. Rapid urbanization again is leading to loneliness, inadequate living space, feeling of rejection, reduced independence, and as has been really spoken about, is elder abuse. And again, elder abuse is very, very, very rampant. And elder abuse can come in as verbal abuse, physical abuse, but it can also come in as neglect. And these sometimes become very, very difficult to quantify. And they are happening. Okay. Now some of the adjustments which we need to understand so that we can understand how to set up programs and what are their needs is role reversal in families. So what happens is first, as I told you, first the parents were kind of in charge maybe, or they were of their kids, and maybe then they lived a very active life, and then they were very much independent. And now the children have to parent the parents. It's not only difficult for the kids, it is also very, very difficult. So it's not only difficult for the parents to accept, it's also very difficult sometimes for the kids to take the role of parents of their parents. And this again has been researched and studied, and amazing results have been coming out of depression in kids, in children of the elderly. Depression. The second issue that is coming up is, especially when the parents were very active. If the parents were always subdued and always, it was different. But if the parents were very active and they were very much in command, in control, depression right now in children who have to parent their parents is very, very high. And therefore, again, the ability to care for their parents goes down. Again, retirement, and of late I've been seeing a lot of people in their early 60s coming to me, and again with depression, but the main thing is that they have not planned for their retirement. They have not planned. They just retired one day and then suddenly, oh gosh, what's life? You know? So unless you plan for your retirement, it makes it more difficult. Awareness of one's own mortality. Now you're beginning to get aware that one disease is coming up. You know, you're like a cart in a supermarket. Okay, diabetes, hypertension, arthritis. I'm just packaging all the sicknesses into one body, and I'm beginning to get aware. Then I'm beginning to get aware that as I'm growing older, I see my friends who were with me one by one, and now I'm alone. And then I'm beginning to get aware of my own impending mortality. You know, we have to understand a lot of seniors go through grief. And grief may not be only of the death, but grief of their own lives, of their own selves. So it is very, very important for programs in the community to stimulate senior citizens, to keep them involved, to keep them feeling active, to keep them feeling required and wanted in society. It is very, very much important to have such kind of programs. Widowhood, declining physical reserves is another adjustment. Changes in income before you get a big income and I go for the pension. You know, so the whole thing changes. Shrinking social world for some. And this is very important, the shrinking social world, again, because of migration, death of spouse, death of your friend, the children, grandchildren. Sometimes they're in the house, but they are too busy. And today with, again, modern addictions, okay? Nomophobia, right? Nomophobia rather, yeah? The mobile addiction. So everyone is at home, they say we are at home, but they are not at home. Physically they are not there. So these are the challenges basically. Now we have to see that, that was like kind of normal problems, but now we have to see that almost 20.5% of the elderly have some form of a mental health problem. So we're also looking, if we're saying 20.5%, we're saying 80% are okay. 80% of seniors do not have a mental health problem, which is a good thing. But we're also looking at 1 out of every 5 elderly person who has some form of a mental health problem which needs to be addressed. Okay, this is like a lot over here, but maybe I will just help you. Don't even bother to look at it. Okay, I will just tell you what it says. There are different types of psychiatric disorders. I mean, psychiatric disorders, not including memory. So there's almost 10.69 million people have that. Then cognitive, like your dementia, your memory problems, almost 5.18 million people suffer from those problems. Functional, there's almost 3.51 million. So again, we're looking at a large number of people having psychiatric problems, not only to do with your memory and your concept, like your dementias, which is very common in the elderly, but also we're looking at people having others like depression, anxiety, and those kind of disorders. I'll leave all this. And therefore, because we understand that the mental health needs of seniors is very, very important, in 2013, the WHO theme for World Mental Health Day was on the elderly. I'll leave all this because I think I'm supposed to wind up. Okay, I'll just talk about suicide in the elderly because COOJ also runs a suicide prevention program, and we need to see that the rate of suicide in the elderly is quite high, 7 per lakh in those aged more than 60 years, against a national average of 11.4, which is still pretty high. Some problems with care. Okay, there's a low level of public awareness about mental health problems of old age. Most hospitals in the country do not have specialized geriatric care facilities. There's lack of training in geriatric mental health in primary healthcare centers. Forget geriatric mental health, there's no training in mental health problems also. Till today you'll find people with depression being given neurobion. till today. Why? Because they'll come with, they do not present saying I'm feeling sad. People with depression will come and say I'm getting a headache, or I'm getting body pain, I'm feeling weak. Because today people in India are still not used to talking about emotional problems. We will still relate our physical problems, our emotional problems to physical problems. So when as soon as someone says, okay, I'm feeling weak, take a neurobion tablet. But almost 70% of people who would have got the right kind of treatment are not getting it. So training in among PHC doctors on mental health is very important. This lack of daycare centers, rehabilitation centers for the elderly with mental health needs, and the implementation of the district mental health program in North Goa, and even in South Goa is, there's just 1 or 2 doctors doing the whole district. It's impossible. So we're looking at programs, but is it very adequate? Okay, I'll quickly go through this but I spoke about the caregiving needs. I gave you that one example, and we need to understand that the burden of caregivers is also very huge. Even in an old age home, now when I go to homes and I look at those, the people who care for them, some of them are not able to adequately care for them because of burnout. Burnout is a huge issue in caregiving. And if we do not look at that, we'll have all these schemes, but they will not be adequate. Okay, I need this. Caregivers have been described as hidden patients. Okay, I'll go through all this. I'm supposed to be winding up like soon. So just a little bit about COOJ. Okay, COOJ is a non-profit organization. We started in 2000. We work for the promotion of mental health, and we have basically 4 programs. The COOJ rehab program for people with psychiatric problems. We have day centers in Vascora and in Vasco. We have the suicide prevention program, which is inaugurated in 2012, and we have a helpline number that's 2-25-25-25. It's operational from Monday to Friday, 3 to 7. The number again is 2-25-25-25, operational from Monday to Friday, 3 to 7. We have the COOJ elder care program, and I spoke a little bit about it, and the community programs of we have camps, and we have awareness programs and stuff like that. Okay, that's our suicide prevention helpline. Okay, it's you might ask me why only like 4 hours and 5 days a week, and why it's not 24 hours. That's a common question, and before you even ask that question, I'll answer it. It's because it's volunteer run, and we have volunteers to manage only that much. Even to manage that number, that time is it's a struggle for us always, because we need volunteers. So if anyone would like to volunteer for our helpline and you feel you have the ability to listen, please give me your names, and we'll put you through a training. It's actually a 4-day training on how to listen. Okay, I'll show you pictures of the activities we have been doing, and again, these are activities that happen twice, thrice a week regularly in old age homes. So this is just a fun activity. I remember when we entered this home, everyone used to sit down like this. Everyone used to sit down like this. And now they sit down like this. And that's the biggest achievement we can have. Just having regular activities. And really, I'm seeing a lot of young people over here today, and I think we are planning for our old age. So when we have these activities, we have to understand we're also growing old. You know? So group therapy, just getting them into activity regularly, having them to play simple games. And here we have volunteers who come in. We have people from our rehab center also who goes and so it's help for them and help for the seniors also. We kind of link up, partner with people, recreation, just making them play games. Then we have the elder child therapy where we bring children into the old age homes. Just like this little boy over there, he's like a little magician. And he goes to each one and, have little magic tricks. And now all the seniors know him by name. They just love this boy. Dance therapy, okay, get them. I remember we used to tell them, okay, in an old age home, the first thing they need to have exercise. When it was exercise time, everyone would run, no, we're not coming. Exercise was not working. So we had to constantly think. We said, okay, forget exercise. Goans love to dance. Can we have dance? Oh yeah, dance, everyone is come. Move your hand up, move your hand up. Everyone was exercising through dance. So it helped. Then we had a senior citizen carnival for the first time this year, and it was a hit. We had almost 250 to 300 seniors from 18 old age homes who came in, and you can actually see them dancing and enjoying themselves. Even this lady on the wheelchair.
God.
Okay. Thank you.
One important part is please keep in touch with Dr. Peter Castellino. You don't have to mob him only at this program, but I think if you can keep in touch with COOJ. COOJ has a website. Okay, so you just type COOJ mental health and the website is there. The number 25 25 25. I think those are things to take home because that's where you start your operational connections. So any quick questions about what Dr. Peter has said, because we've got time. Our next speaker, Mr. Swapnil Naik is already here, and we cannot delay too much the lunch part of it also. So any quick questions or clarifications that you have, which you would like to field to Dr. Peter?
Hello sir, I am Sanjeev Asgaonkar from Bicholium. I am running one Ummid Old Age Daycare Center. I actually wanted to start meditation course for senior citizens. Don't know how to go about it. Please guide.
That's a query. We'll note it, and even if doctor cannot respond right now. So if you have got requests like this is also an interesting point. Please write it down. You can then send a slip forward with your name, address, whatever, so we can do communication. Any other clarifications or questions that you have, or assistance? Yes, Maria.
Dr. Peter, your place in Vasco isn't well defined in the sense that there's no board or anything like that. I know it's in Tilak Maidan, but when I try to, identify the place and someone just says that it's a South Indian lady in whose house it is, am I right about that? Yes. But there's no board or anything like that.
There is a board.
There is a board. I know that you go down that road and you look to the left.
To the left. That's the house. I'll give you the direction.
Okay.
Okay. Any questions? Yes, Sharmila.
I just have an input. I'm from the medical background myself, and what I feel is, correct me if I'm wrong, but we are looking at a community, and I felt this even when we did programs for kids, that we look at kids separate, we look at adults separate. It's a community. I mean, I'm 50 today, I'm going to be 60 tomorrow. So it's a continuous growth. So instead of looking at something like cancer or something that's out, how do we bring it on? Like I have a 72-year-old mother who drives. I don't drive. She treks up the Rwandan mountains because she wants to see mountain gorillas. She did this at the age of 68. See, somewhere we do not like, you did mention, and there's also somewhere where we need to tell people that we need to evolve technologically to keep in touch. She's on chat with my kids. She's mobile savvy with my kids. So maybe we need to address that small gap. I don't know, this is my personal take.
And in fact, this is a fantastic thing because I attended a seminar recently on aging, and they're saying most seniors do not want old, outdated Nokia phones.
Yes.
They want the latest tabs.
Yes.
No, and in fact, they're even looking at how we can push the age for seniors to almost 121 to 30.
Can I just what actually happens when I go home is I have this whole plan of, being the daughter of the house, I can be a little teasing. I tell them senior citizens forum, my mother and her cousins are together, and my daughter actually teaches them how to use it. They are waiting for her to come with, because they want something updated in their laptop.
But these are the seniors who are fantastic for day centers, who can actually set up communities like in Porvorim.
Okay.
There is a very active senior citizen group, and all people who are cognitively well, they are in that group.
Okay.
So you can see even in this community, you'll have, it's not very homogeneous. It's very heterogeneous. You'll have the needs are varying. Some people are very cognitively good and very tech savvy. Some are not. Some are more disabled. So I guess those kind of people who are more active can actually look after people who are less active. And that's what we're trying to do through these community programs, integrate.
Okay, now one other place, this is again an observation, is, can I? Just one more?
Yeah, because we have other hands showing up. Sharmila, I would like you to send this on email if you don't mind,
Yeah.
what you said. And I'm saying this to others also. There are many thoughts that may come along the session. Just make a note of it. Please send it on email to us. That would be really helpful. Yes.
Sir, you spoke about community programs for senior citizens. But there's also, as you rightly mentioned, there's a stress on the caretakers. So are there any community programs in place to give support to these caretakers who can, in fact, make it better in the homes?
Unfortunately, there is no service for caretakers. There was only some research work that was done, but no programs as such. No. But we do have support groups for people, of caregivers, not of senior citizens, but yeah, of mental health problems. COOJ does run a support group for them.
Yeah. So, as I said, last question to you, last question, because we are really out of time. Is it a query?
Yeah. Emotionally, people are different. Some people are extrovert and some people are introvert. Now, the senior citizens also are not homogeneous. Now, do the introverts have the problem of emotional support? Because throughout their life, they avoided people. They don't like any support from the people.
Again, that would vary, because if they are very comfortable with who they are and what they are, if they have reached the level of acceptance that that is who their personality is, I don't think they'll have any problems.
Okay, I have to say time out. We are getting slips like this, so please feel comfortable enough to write, pass it on. You can also email it, no problem. But as I said, we've just finished the second session. The third session will start now before we go for lunch.
Thank you all. That was the session on caring for the elderly with Dr. Peter Castellino, Managing Trustee, COOJ Mental Health Foundation. On behalf of the organizers, I request Coordinator Goa and Roland Martins to kindly hand over a token of appreciation to our speaker on stage.